A 24-year-old man presents with a 7-day history of fever, a productive cough, and right-sided chest pain. On examination, there is a widespread rash affecting his arms, legs, and face. Auscultation of the chest reveals crepitations over the midzone of the right lung. Blood tests show a white blood cell count of 4, platelets of 160, and a hemoglobin of 7.8 grams per deciliter. Peripheral blood film shows polychromasia. Biochemistry reveals sodium of 127, potassium of 4.5, and serum bilirubin of 2 mg per deciliter. Lactate dehydrogenase is raised. Based on these findings, what is the most likely diagnosis? Answer options. A. Community-acquired pneumonia with G6PD deficiency hemolysis. B. Mycoplasma pneumoniae infection with cold agglutinin hemolytic anemia. C. Legionella pneumonia with disseminated intravascular coagulation. D. Pneumococcal pneumonia with autoimmune hemolytic anemia. E. Viral pneumonia with aplastic anemia. Answer is Mycoplasma pneumoniae with cold agglutinin hemolytic anemia. Young adult with a typical pneumonia, rash, hemolytic anemia, that is low hemoglobin, raised LDH and raised bilirubin, polychromasia are classic mycoplasma with cold agglutinins. Normal platelets rule out DIC, aplastic anemia, no G6PD trigger given.